That's the thing, actually, good stuff. Okay, I think we'll get underway. I think the members. Online, MSP colleagues, Sarah Boyack, and I think Alexander Stewart will be joining us at some point as well. Friends, you are very welcome to this meeting of the cross-party group on Malawi. And those who don't know me, I am Liam MacArthur. I'm one of the co-conveners of the cross-party group. And as I said, I acknowledge our deputy convener, Sarah Boyack, who I know has another engagement running coincidentally with this, which will surreptitiously be sloping out of the room at some point. But we won't draw attention to that when it happens. Alexander Stewart, my co-convener, hopes to join us at some point too. So you're all very warmly welcome to the Scottish Parliament. The event, as you probably picked up, is being recorded and put online after the event. So your participation in the meeting is being interpreted rather liberally as consent for that to happen. Although if you have any objections, please do let me know. We have several speakers here in the room here in Hollywood, as well as a number online from Malawi, and there'll be time for questions and discussions after the presentations. I think we're going to store up those questions as we go and then unleash them on our unsuspecting speakers thereafter. Then that I think would be the best policy. Yeah, as I say, we're aiming to close around about 7 o'clock. We started a little bit late, so we possibly overshoot. So at which point you will then be unleashed on the unsuspecting gin and tonics that are sitting at the back of the room. SP and from colleague Dr. Alistair Allen and SP and apologies too from Dr. Barry. First up is the approval of the minutes from the last meeting. There should be printouts available. So we welcome any suggested changes or amendments, and if not, somebody to those. Happy to move them. Thank you, Sarah.
Sorry, the cameras seem to have gone off.
I'm just got busy and given up. Whoops. Are we at least being here?
And it was flashing red, but it's on off now.
All right.
Hopefully something. Someone's got it coming. We're
We're back on. Excellent.
So eyes are on again.
Good stuff. So,
Second
thank you very much, Alexander. That's through the minutes. Thank you very much indeed. Right, on to the main substance of tonight's meeting and discussion. In 2018, the Scottish Government funded the MalDent Project, a partnership between the University of Glasgow and the University of Malawi College of Medicine, now the Kamuzu University of Health Sciences, or KUHES, to establish a dental school in Malawi. The Bachelor of Dental Surgery curriculum was developed, and excitingly, the first cohort of graduates graduated in April of this year. Today, there are 124 students enrolled. Clinical training has taken place at Kamuzu Central and Queen Elizabeth Central Hospitals, but a dedicated teaching facility was always felt to be essential. The MalDent grant supported the design of a new dental teaching building, which also includes shared space for other KUHES health disciplines. This successful design phase helped secure $5.2 million from the World Bank, construction now happily underway. It's led by John Caslin and partners, a consortium of Scottish and Malawi architects, engineers and surveyors driving forward the project, showcasing international collaboration across health education and infrastructure. And tonight's first-party group meeting will hear from various project partners who will share updates on this initiative. Our first presenter this evening is Dr. Peter Chimimba from QS, the Malawi MalDent lead, who will speak about the need for dental graduates in Malawi. It's going to stick to a rigid 10 minutes, after which we'll move on to the next speaker. So over to you, Peter.
I can't see him in the button keys, I'm afraid.
Yeah, I was just wondering. Somebody looked like they were preparing to speak, so I was
He messaged me a few minutes ago to say, has the meeting started yet? And I said it's about to.
all right.
He's probably not been invited to join us.
He does the meeting.
Hello, I'm available. Can you hear me?
Thank goodness for that, Peter. I was sure it was you that I to speak. So
It's under user.
yeah.
I hope you can hear me.
Can hear you loud and clear, Peter. The floor is yours.
Thank you very much. I'll be making a case for why Malawi needs to train dentists, and I'll speak briefly for about 5 minutes to make up this issue. I hope you can hear me.
Yes, we can hear you, Peter.
Oh, okay, right. Oral health problems are quite significant cause of morbidity in Malawi. Globally, we also know that dental problems are of considerable cause of absenteeism in schools. And during this presentation, I'll make a case for two main reasons why we need a dental school. One challenge is, yeah, the next slide.
One sec.
Yes, yeah. Well, the challenges, one is the challenge of oral health care, is the workforce, and then the other one will be on the disease burden in Malawi. There is a critical shortage of dental professionals, and as a result, there's very poor healthcare services. As of July 2025, the population of Malawi was 22.2 million people. And the number of dentists in 2023 was 50. You compare that with the UK at 33,600. I mean, the figures speak for themselves. When you look at the dentist-patient ratio, it's almost 1 per 500,000 for Malawi and 1 for 2,000 for the UK. That is within the recommended WHO ratio, and we're way outside that. And as you can see, these figures speak for themselves. The second challenge that we have was to do with the disease burden. And we carried out in 2023, the first national child oral health survey. And that survey was done for 6 to 12-year-old school children. And we had 6-year-olds, about 1,330, and 12-year-olds, 1,611, almost about, in total, about 3,000 students. The overall result was that 47% of the 6-year-olds had prevalence of dental decay, dental caries. The figure was slightly higher in the northern region, which was at 65%. And for 12-year-olds, 23% of the 12-year-olds had experienced dental caries. Of interest, and more importantly for us, was that none of the children had filled teeth. The survey measured decayed, missing, and treated teeth, and that was telltale for us. There was just a few with evidence of dental extractions. And this for us is of concern because we are having a lot of significant problems in oral health with no children with fillings and no evidence of very little evidence of dental extractions. There's evidence enough in Malawi to make sure that we train dentists to improve their availability, equitability, and equitable deployment of all cadres of oral dental health workers. The other problem that we're having is in oral disease burden is the issues of oral cancer and large oral tumors, which usually present very late. We also see a lot of problems with HIV-related oral health conditions. Trauma is on the increase, and this has been exacerbated by the increase in the number of motorbikes and motorcycles that are being used on our roads. It is in this background that we feel the country needs to train a higher qualified dental health professional who will deal with these problems in the long term. That's my short presentation, and it's my pleasure to ask my colleague, Professor Bag, who is the colleague in MalDent coordinator in Glasgow. Over to you, Jeremy.
Thank you very much indeed, Peter. I think you set him up perfectly. I have nothing further to add over to you.
Thanks very much. So let's just read a little bit of the background context before Peter and Patrick talk about the building itself, which is the main meat. So just to let people know that the sequence of events. So we started with a completely blank sheet of paper in 2017. So a curriculum had to be developed, and actually Peter, who you just heard, played a very large role in getting that set up with Nigel Makandawiri. Then we needed recruitment of students. So the first students were recruited in August 2019, and that first cohort are the ones who have just graduated in April, as you can see in the bottom right-hand picture. We had a big issue with infrastructure for clinical teaching. So we worked with a charity Dente, UK charity Dente, and Henry Schein, big dental supply company, and we completely replaced the equipment in the dental department at Kamuzu Central Hospital. Using equipment actually that had been largely donated by NHS organisations in Scotland, particularly Glasgow Dental Hospital and School. The World Bank put some money towards initial staff recruitment. Staffing is an ongoing challenge for a variety of reasons we can talk about at the end, but we augment the clinical teaching staff with flying faculty. So we fly in groups of 5 to 6 individuals from UK, but they've come from other countries too, more recently, particularly South Africa, where we do concentrated training in things like prosthodontics, advanced restorative, and that augments the teaching that the existing staff in place can carry out. So that's where we've been to so far. Now, we heard for people to care, but also some of these young individuals will hopefully become teachers, and that in turn will help with the staffing issues that we have. And then from the Ministry of Education, Dr. Lewis Anaya, who's actually very recently visited the building site, actually, big milestone, and the Ministry of Education will do all they can to support CUHES with this fledgling programme that it does need to be sustained if it's going to continue longer term. And so really the last bit of the jigsaw was to have a purpose-built dental school building. As we heard earlier, it's thanks to the Scottish Government funding for the design that we're then able to leverage from the World Bank SAVE project the 5.2 million to support the actual construction, which started in May of this year.
Over to you, Peter.
Okay, evening everyone. Thank you, Jeremy, thank you, Peter, thank you, Lynn. It's a really great privilege to be here tonight. I think it's been a great privilege the last number of years working on this project. It is a project which makes it's going to worthwhile being an architect and the sort of impact that this building can have on people. So I think just before we get into the meat of the presentation around the building, I just want to say, this is both from Sean McCaslin Partners, and we've also got MOD Architects and Patrick on the call as well. I'm going to talk in a few minutes as well, but it's been very much a kind of collaborative team effort, both from various engineers and experts in both Scotland and in Malawi, which is showing the results of that are moment coming out of the ground as we speak. So maybe just a little bit of background about us, John McCaslin Partners. Just put up a couple of slides of sort of projects from the UK. So things like King's Cross Station, big project we led, project top. The UK's Museum of the Year 24. But then maybe just a bit more relevant experience around this sort of project we're working on. On the top is a kind of series of buildings that we worked on a number of years ago in Malawi. Is this the mic?
I think it's the in-house. Yeah, you could.
Is that?
Yeah.
I think it's the internet in the room that's waiting.
So a series of rural classrooms that we developed for the Bill and Melinda Gates Foundation, which there's some photos that have been built. Bottom left, project in Haiti after the earthquake in 2010, the rebuilding of the eye market that sort of was largely collapsed at the time, completely refurbished, and you can see it in busy action there. And then bottom right is a cathedral in Kericho in Kenya. So a broad breadth of experience working across the world, which we've tried to bring all of that experience together for our project in Malawi. So very briefly, just to we've got the story for yourself. We'll briefly run through the context, a little bit about the brief, a bit about the building, and then Patrick will take us through progress and where we sit today. So context, obviously I'm sure most people here are fully aware of what we're looking at, but I think kind of for us anyway, in particular, it's just very interesting to look at the map with the Mercator projection slightly corrected, and actually seeing kind of where Malawi sits, and actually the sort of in many ways the proximity to the equator. If you mirror that, you're kind of broadly across the Sahara, and so that kind of location there, which I think is very much the kind of starting point for us in terms of looking at the buildings and just understanding the climate and the implications of that, and how do we design something specific for this instance in Malawi, rather than sort of trying to import something that's been successful elsewhere, which probably won't be successful in the kind of Malawian context. So not that you're probably going to understand this, and not that I necessarily do either, but it's a kind of detailed dive into the exact sort of climatic conditions of Malawi. So really understanding that, which this one might be a little bit more decipherable, which very broadly maps out the kind of overall temperatures across the year. And I suppose you can look at the kind of key to the bottom, sort of the cool, comfortable warmth, which gives that kind of range of actually from sort of, well, anywhere between 13 and sort of 29, 30 degrees is pretty much where the kind of climate in Malawi sort of sits, and largely microclimate and also the altitude that it sits at. but actually perhaps not quite as extreme temperatures as you might expect in that sort of proximity to the equator. But this very much sort of fed into the overall design as we developed it. So again, we are quite legible, but obviously the building's in Blantyre, towards the south of Malawi, and the actual site itself is the campus is very much within Blantyre, but sort of a little bit south of the main city centre, as it stands. So this is the overall campus. So Patrick's firm MOD were heavily involved in the original design of the campus from sort of 80s and 90s. So that's the main bulk of the buildings to the north of the campus. But there's a kind of broader master plan for the future development of the campus and additional buildings sort of moving down towards the site. And where the big yellow circle is essentially where our site is located. So it's very much a kind of sort of key intersection or a knuckle of the site, which I think in many ways we hope is going to sort of set the agenda perhaps for how the future development of the campus is going to be built. So this is an aerial view looking down on the campus, and you can just see the kind of yellow area sort of coloured, which is where the site is. But the existing campus as it stands is a series of very fine and successful buildings. These kind of long forms create these external garden spaces in between and connected with these sort of canopy walkways, which all work very, very successfully. So certainly we feel, and this is the campus itself, and the top view showing the food chain, and the bottom two ones showing the actual site itself, which I suppose fairly barren and not of particular interest, but there's definitely a kind of notable fall or slope across the site, which is sort of typical of the campus, and these sort of cascading forms of buildings across the sort of landscape, with these very enjoyable and appealing sort of walkways sort of connecting the buildings. But the buildings themselves have been sort of designed very much to the specifics of the climate, very much working with the kind of environment in Malawi with these sort of whole vertical fins which provide sort of shading and the internal spaces, and in many instances allow the sort of spaces inside to be sort of kept at a temperate conditions without sort of becoming too extreme. Obviously there are instances within the campus of air conditioned spaces, but the kind of success of the original buildings is very much sort of evident in how they perform internally. And I think importantly give us quite a strong character to the overall campus, and give it an identity for the students and for the wider entire area. So this series of diagrams, not particularly legible up on the screen, but just illustrating the kind of fall across where our site sits, which is not enormous or not sort of cliff edge, but it's certainly something that comes into play a little bit later on. So then moving on to the brief. So from the very outset of the design of the building, it's kind of idea of sort of not just solely providing education and teaching spaces for the students, and could this building do more? I think this is obviously both for the dental faculty students, but it's also about trying to bring together students and also members of the faculty from the wider College of Medicine, and also the public together. So this idea of casual collision sort of was a key sort of aspect about how we can sort of make some of those more informal conversations take place, which I think is in many ways a key part of learning, certainly at tertiary education. So the first sort of example of casual collisions was the series of workshops which we held as a team at the beginning of the project. So getting together in a room, series of workshops, getting ideas, and letting everyone voice their opinion as to what this building should be. And I think very much looking to making sure that this is a building that's meeting the requirements of the students for Kuhes and for Blantyre and Malawi. And this is not definitely going to be a sort of imported design that has been prepared somewhere else, but it's very much rooted in Malawi and the needs for the museum. So out of that, sort of series of key themes, I suppose, came out of this, which, you know, alongside the key teaching spaces, which we kind of consider to be a given that the building is going to provide those, but what else does it need to provide for this? So these sort of five key aspects: identity, character, materiality, flexibility, and connectivity, were sort of very much woven throughout the design going forward. And we sort of took those ideas and broadly started arranging, you know, how, you know, there will be some spaces very much specific to dental school, but then how can those spaces also become also utilised by the College of Medicine, and then also going to be used by the public. And then broadly just working through these kind of areas and understanding them and understanding the requirements for the different spaces. We also started mapping those out and sort of the adjacencies of what those different spaces needed, where they need to be positioned by, and what the key adjacencies from a purely functional perspective, and then also from a, you know, how they could work even harder than the sort of basic requirements to them. And then finally, there's a series of sort of international exemplars, sort of both dental schools on the top left, top left, bottom left, sort of laboratory, medical, clinical teaching spaces, top right, sort of modern higher education spaces, which, you know, encouraging these sorts of different ways of using the space, and also sort of conversations that can happen at different times. And then finally using the sort of external space and how that could become a sort of key component of the design. So not necessarily to directly import them, but to kind of take lessons and the sort of advantages and disadvantages from these spaces that we can layer into the proposal for the MalDent project. So there was a whole series of options that were developed and iterations and sort of back and forth with the wider project team over different approaches and the kind of advantages and disadvantages of all of these. And very broadly, that sort of concluded in the sort of bottom right with these sort of series of linear bars that sit across the site. But it was sort of essentially at this point that COVID really hit the project, which somewhat put the brakes on things, and the project kind of went on a rather deep pause for as many things did at that time. And then I think when the project sort of re-emerged and got going again, many things changed. The financial situation had quite significantly changed, and, you know, the money that had been earmarked for the project suddenly wasn't going to go quite as far as it was. So we had to put our thinking caps back on and think about how we can deliver a more efficient building still within the budget, which was essentially fixed from the largely from the World Bank and from the Scottish Government as well. So taking those kind of linear bars, we sort of worked out what would be the most efficient way of delivering the kind of area that we could do. So coming up with the most perhaps rational space that one can do in a square. So perhaps the polar opposite of the building that we're in at present. And so we took that sort of square and, you know, worked through how we can sort of develop it. So working on a very rigid grid, and so looking to provide well, as we've got it set out here, almost with the square with a hole in it, so kind of a donut effectively. So looking to provide a kind of auditorium, sort of flexible space that you've seen before in the centre of the building, and then sort of radiating around that, sort of 4 primary spaces on each floor, sorry, which we can repeat across the space. And I think, you know, we worked through this and, you know, kind of find that this both provides the functional requirements that are needed for the school. And I think importantly, it also gives us the flexibility so that in 5-10 years' time, when things may have changed about how the building wants to work, how teaching wants to be taught in the space, it's very simple to switch that. So, you know, from taking that very simple diagram, we start to sort of working that through and building that up. So you can start to see in the kind of corners, you know, this is where we place all the functional things like toilets and lifts and stairs. But then, you know, we still have these sort of key spaces that rotate around that. And then all sort of links around the central auditorium, which is open and can be used sort of flexibly, but, you know, provides a sort of central hub for the students and sort of a connective space amongst all those others. And again, kind of working through this, you can sort of start to see the further detail that's developing and evolving across the space, and is essentially the building that we are at present sort of building today. And then I think this drawing is a plan which is actually looking up at the ceiling. So you'll see in a minute, we have a structure which is these ribs that run along it, and those ribs are all orientated towards the central core, so that all the building services, the pipes, the cabling, etc., all sort of connect there, and they all have a logical route to run through the sort of beams as we have them. So it's very, very rational, but I think as we start to illustrate, you know, I think there's a kind of charm and character and we would think beauty to it, be the judge of that, to what the result is. So we have this lovely model of the building, which actually has almost like a doll's house. You can pull out sort of trays and show the sort of space of that, which is currently in Malawi and being sort of used to kind of help explain the building. So this is the sort of lower ground basement floor, first floor, sort of primary level of entrance, and top floor, and our lid that sits on top of it. So the building, I mean, picking up some of the cues from the existing architecture on the site, you know, we've utilising these sort of tall vertical ribs across the building, which you know, help with the kind of environmental sort of buffering the external conditions, providing shade to the internal space, but then equally still allowing lots of openable glazing to allow sort of fresh air into the building, allowing it to be passively cooled. And the building also sits entered at ground floor level coming from the main body of the campus, but as the hill slopes down, it goes from a sort of 2-story building into a 3-story building. So the lower level has a small number of teaching spaces, the computing lab, but mostly has sort of some of the backhouse spaces and toilets and changing spaces and things like that for the students, with the primary teaching spaces up above at the ground first floor. So this is a building section cutting through the building. So you can kind of see right in the centre is this auditorium, which helps basically drive a kind of passive, naturally ventilated building strategy. So that central auditorium is open. It has it has a roof on it, but then at the top of that, to the side of that, it's very the side. You see there it's open there so that, you know, hot air within the building will rise up and it will pass out through the building, and, you know, cooler air from outside will come in at lower levels, and then all of the spaces around this auditorium will can be ventilated through the building and then up through there. So we get a sort of cross ventilation through each of the classrooms. Equally, those can also be closed up if there are issues with noise or privacy potentially within the space. So there's all being sort of modelled in the computer, and its sort of thermal performance and how this is going to be kind of result in temperatures internally and externally. Again, hopefully the broad impression of orange and red outside being hot and blue and green internally being inside shows that the kind of overall design is sort of working. And I think a key part of the building is, the design has been about maximising the amount of natural ventilation that we utilise in the building. So the vast majority of the building can be naturally ventilated. That's obviously generally a good thing for the environment, for sustainability, but importantly, in Malawi, where there can be power cuts, this allows the building to still operate, and also importantly, it helps to keep the cooling and sort of electrical bills to a minimum for the university as they operate and run the building. So this is I suppose probably the most important building in terms of pure function, is the spaces for the actual teaching of the clinical spaces for the dental students. And then we have more general teaching spaces, which will be used both by the dental students, but then also, it can be used by the wider campus, sort of flexibly, so that there's that sort of crossover between the different departments within the space. And then, I suppose moving to that side of the building, you'll probably notice the building is made of brick, which I think is traditionally or typically in Malawi is by far the most common building material that's used. Very often it's used in quite an ad hoc fashion, that people will dig up some soil in their very near locale and will form a kiln and buy the bricks, and it can be quite a variable quality to it. And that may be fine if it's a very simple single-story building, but we've got a sort of international quality teaching building, so we've kind of we did a lot of research into that. And I think the other big issue with bricks in Malawi is that bricks are typically fired in a kiln, and very often those in Malawi come from, or the fuel for that is timber, which can be sourced from unsustainable locations. So yeah, you kind of see very all over artisanal sort of both timber and charcoal that's sort of being taken from unknown sources and can lead to significant sort of deforestation across the site. So we're very closely finding a local manufacturer in Blantyre, which could source, was producing bricks. So they have a quality control of the actual clay that they use, and their first step is actually to air dry them, so a big chunk of the actual energy required is sort of emitted by the initial air drying of them. So you can see that on the left. It's a very manual process that's used in these processes, which in many ways gives a quite characterful brick at the end of it. But the timber that's used is they do have sort of sustainable documentation that comes alongside that, and this is one of the key things that the funding from the World Bank was contingent on, sort of establishing that the building is not going to impact on deforestation. So being through that process with the World Bank as well, we're sort of satisfied with the process that we've concluded on. And then perhaps the final point around the design is the landscape and the sort of setting that this sits within. So very much looking to increase the sort of amount of vegetation on the site, and also increase the use of local indigenous fauna. And into the site, and then also a key part has been avoiding the kind of removal of material, reducing that to an absolute minimum. So we're sort of working with the site, and the amounts of soil that's going to have to come out for digging foundations and things like that. That sort of regrade. There is a kind of opportunity to be used, right? And sort of flexibly, and I think over time will be sort of inhabited with different types of furniture, etc., and we'll sort of provide that sort of space for students to sort of congregate and sort of have informal study discussion outside of classes and sort of waiting for lectures and those sorts of things. So I'll pass on to Patrick, who's going to give us a very little sort of tour.
It's quite interesting. My whistle stop. I'm conscious that we need to protect a bit of time for discussion. Those of us in the room will be able to carry that on over gin and tonics. But Patrick, if you could go through your slides as quickly but without missing out key points if possible, that'd be.
Good evening, all. Can you all hear me?
It's moving on my screen.
There we go. Patrick, can you hear us?
Good evening.
Good evening.
Can you all hear me?
Yes.
Yes, we can.
Yes, we can hear you.
Okay, good. Thank you very much for this opportunity to present a little report. Basically, my report touches on progress of construction works. Just the details, some contract details that you might be interested in. The contract commencement date is 8th of May, 2025. The contract completion date is 30th of December, 2026. However, the contractor has agreed to try and complete at least the superstructure by the 30th of June, 2026, which is 6 months earlier, to comply with certain deadlines that the World Bank require. So with that quite challenging target, the contractor has kind of made a very good start. And as of 15th of September, which is 2 days ago, I can report that the whole substructure, which includes bulk earthworks, foundations, retaining walls, the basement floor slab, and all the underground services are complete. So that probably accounts for about 25% of the total building. The target is to achieve completion of the whole superstructure to roof level by the end of December, which is 3 months away. It's quite a challenging task, but I believe that the contractor is doing his best to speed things up. The photograph that you see here shows you the retaining wall basically completed, and the contractor is busy now working at what you call the lower basement or lower ground floor, erecting the formwork and steel reinforcement for the shear walls and the cores and the columns. Once that is done, then the ground floor will be poured, and the deadline for that is by the first week of October. That's 3 weeks away. It probably is a bit ambitious, but they will be close to that. So at this stage, I can report that the quality of workmanship is pretty good. It's as good as we would get from any other contractor in Malawi. The effort, I must say, is excellent. The contractor is working with us as a team of consultants. That is all the Malawi-based team. We're working pretty well together, and we are hopeful that we will meet the targets that we've set. Maybe, Peter, you can just flip through the other slides just to show the other angles of view if you have them. But in a nutshell, this is where we are. So from Peter's beautiful drawings, you can now imagine what is happening on site. So it's a small building, but it's pretty complex, and it requires quite a lot of accuracy in terms of setting out. But that's our job on site, to make sure that the contractor complies with the requirements of the drawings and the information that we give him in terms of specifications. Yeah, that's about all I can report at this stage.
Thank you very much indeed. We had a couple of glitches with the technology, but I think we got the gist of it. So thank you very much indeed, Ashik. So at this point, I'll throw it open to questions or to comments. I think if you're online and wishing to ask a question or make a comment, if you could put that in the chat function, and either it can be read out here, or if you would want to ask the question yourself, you'd be very welcome to do so. You can let us know, and we'll invite you in. So who wants to kick off? Could I maybe start going back to the original, the initial presentations from Peter and yourself, Jim, about the cohort that graduated in April. I mean, I was doing a quick head count in the photo. It looked to be about 10. It is 10. So are those 10 accounted for in the overall total of 50 qualified dentists that Peter was referring to? Or is that in addition?
Right, so we actually don't know how many dentists and therapists there are in Malawi. I've inquired the medical council, they don't have any electronic records. So all they've been able to tell me is how many dentists and dental therapists have ever been registered since 1945 or whenever it was that they started registering. So it's an estimate. So plus or minus 10 on 50, we can't really give you an accurate answer, but we're working to 50 at the moment.
But it would suggest that if you're graduating 10,
yeah,
that actually you're increasing
we are
quite exponentially.
We are increasing a lot. It would be a big increase. And then the next cohort coming through the 14, and then after that, it's groups of between 20 and 30. So the numbers are going to ramp up quite quickly. In a strange way, that actually puts pressure on the system at the other end. So in terms of organising and paying for internships, and then the big challenge we haven't talked about really tonight is where are these dentists going to work? Because there aren't a lot of good dental facilities. And one of the other projects that we're doing with the charity Amica is we've established a 2 dental surgery clinic at Chilamoni Health Centre just outside Malawi, which will be absolute state of the art. And we'll be sending some of the senior students there for outreach teaching as well as improving the local service. But we need a lot of those. So everything we're doing for the first time, and it's difficult for the first time each time, if you've seen any.
And in terms of completion was of that cohort of 10,
yeah,
did it start as a cohort?
Yeah, it was extremely good. Yeah, and they're now doing a year of internship in central hospitals before they register fully with medical council, and then they're fully fledged and they can do whatever they can find.
But I suppose the longer that issue about where they then further develop skills and get work placements, etc. And the longer that goes on, the question mark over the higher the risk that they end up getting drawn away.
Completely, yeah. That's a risk. Yeah.
I'll come to you and then yes.
I was very interested in the expression casual collision.
Casual collisions.
Yes. When looking at creating, if you like, a whole new dental educational service in its own right, okay, as well as the dental service, I'm wondering whether you get more added value if, as part of the medical training programme, you had dental awareness, the whole oral gut relationship, and also with the teacher training to build that in. And I'm wondering where you can bring in indigenous wisdom about good oral health and diet, okay? And because you might find with younger ones, they're getting more exposed to things that are more harmful to their teeth, etc. And finally, with respect to one of your pictures there's this lovely big ditch around your foundations, okay, your retaining walls. Could that be constructively utilised to actually lay some ground source heat pump into that whole thing as you're holding it back?
You want to? Yeah,
Do the building bit first. Building bit first. I mean, I think it potentially could be. I mean, I think there's a kind of, we did go through sort of whole exercise, of what is the most appropriate and cost effective solution for the kind of, I mean, generally, the building doesn't need heating.
But it may be used for cooling.
Yeah, absolutely. But I think what we've looked to do is essentially avoid actually having to cool because the climate actually doesn't get so hot that we're avoiding that. And no doubt it brought benefits, but there's a cost.
Electricity, etc. Can't be used.
Yeah, no, definitely. I mean, we don't really touch on it. On the roof, we've got PVs, which are generating electricity. Wasn't given quite as much bang for buck as other sort of solutions were, I think we're always trying to come up with as simple a solution as possible. Opening a window is probably not going to go wrong because ground source heat pumps potentially do, and often, with technologies like that, if it's not something that's commonly used in an environment, when something does go wrong, then nobody knows how to fix it, and then before you know it, after 3 months of it working, it will never work again, and you've spent X thousands of dollars millions of patch it, and it's sort of it's kind of slightly useless.
The other 4 questions I maybe chat to you about is actually, they're all very good questions, and they're all things that we're thinking through or already doing. So if that's okay, just for time.
Great. Okay, I've got a couple of questions online, but I'm going to stay in the room for now and then come back to Heather and Carol's question.
I mean, congratulations, and that was really fascinating to think through the process with you and also learn how you had to pivot post-COVID to a new design while still retaining what you had before. I've been involved in the University of Edinburgh as living in a building or a new building that's been designed and we had to go through COVID as well. And that whole casual collisions, just as that you mentioned, I think is really important for that interaction between students and staff and external population. But I wanted to pick up on the dental public that was mentioned somewhere, and the sort of clinic space and accessibility for local Malawians who are coming there. Is that something that's built in, and how have you worked with maybe the local dentists and the people coming through as dentists, or the local population as part of that?
Shall I go, do you mind? Well, yeah. I mean, the building, I suppose predominantly is built as a university building, and it's got one primary entrance, but then we've also got a kind of secondary entrance, which gives an entrance into the private clinic entrance, so that can be used out of hours, separate from the university building, and Kevin, you probably say a bit more in this, but it's set up so that there is both a private clinic for fee paying some sort of commercial side of things, but then also the members of the public will be able to as part of the training, dentists will be offering that kind of dental service with them, presumably supervised and by sort of at different stages and what they're sort of offering. But
so it will increase access both for paying and non-paying, but also, I mean, the key message we're trying to get across through the policy we've created as well is around prevention, but the trouble is, as Peter Chimumba said, there's already this huge burden of disease, so you can't just focus on prevention. But the beauty of the public space will actually be largely for health promotion, so we can bring the local community in, and that we don't aim just to do that at this building. That's another reason we've set up Chilamoni, and we're already working with local schools and churches and so on.
I'll come to Carol's on this question first, because it links back, I suppose, to the question you and I were discussing earlier about sort of creating this pipeline, but then where does it go? And Carl's suggesting that if there aren't the funds to pay them, the roles in which they can be sort of gainfully employed, one could see a kind of mirror image of what appears to already be the case with registered nurses, where the lack of MCH funding is really probably there.
So, do you want to comment, Jen? So I mean, clearly it's a really good question. I've spoken to Peter Trimimber about this. I mean, clearly what we would like is at least some of these new young graduates going and working in the more rural areas in Ministry of Health facilities, which we need to keep pushing. But there is still scope in the larger communities for more private dentists. Now, that's not the only ambition here. But I think Peter Trimimber's view is that at the moment, there is still scope to absorb, because we're starting from such a low base. But it's a very, very important point. I mean, even paying interns, I know there are medics who graduate who have to wait a long time for an internship because there simply isn't money to pay them. So it is a challenge.
Heather Cuby's put a question in the chat function, which actually occurred to me that timeframes that you're working to seem heroically ambitious, but you suggest that you're on track, which is very encouraging. But is there a concern about potential impact of rainy season and whether that puts the plan completely off course, and what the implications of that might be with funders and sort of hitting the benchmarks that you've committed to hit?
In terms of the targets that we've agreed with the contractor, the critical path really is to get the building roofed by the end of December, because our rainy season kind of starts in December up to April. So if the building can be at the roof level by the end of December, it will mean that the contractor can then work on the inside undercover, basically. So I think the target of finishing the superstructure without necessarily all the finishes and equipment by the end of June next year is not impossible. But of course, the construction industry is a bit unpredictable at the moment in Malawi, especially when it comes to procurement of materials or the availability of materials and resources. So yeah, we don't know what can happen, but in terms of the targets that have been set, I think they are achievable. But there's always a risk that something might happen that is unforeseen, and it could put a spanner in the works. I should say that as consultants, we did anticipate that we would need at least 20 months to complete this building, which would hence the 30th of December 2026 completion date. But because of other issues that the donor specifically insisted on, mainly that the funding cutoff line is 30th of June 2026, by which time they expect all, if not most, of the contract funds to be dispersed. That is a problem, but the only way we can address it is by saying that we can finish the superstructure, which is everything up to roof level, but the building will be incomplete in the sense that all the internal finishings will not be complete. But at that point, we will have to make another arrangement as to how it can be completed within the same funds. That is something that we'll still need to address. Everyone, I think, is currently scratching their heads as to how this could be done. But as an architect, I can only say that to expect the building to be 100% complete next June is impossible. But the superstructure, yes, that is feasible. Does that kind of answer your question?
I hope so. It was Heather's question, but it seemed a fair stab at answering that question to me. Yes.
Just a thought, is there any scope that the funding could be put into a trust on behalf of the project, and therefore it could be handed over from the World Bank by June, but only released further lining up with the completion and quality control deadline to give a more realistic balance and take some of the pressure off?
I believe that's what everyone is working on. Peter, maybe you know a bit more about this, the progress on that aspect?
I mean, it's, you know, there were many discussions with the World Bank and what the options might be. They seem to be fairly rigid in not necessarily accepting, you know, options like you've outlined. You know, but I think that was predominantly about getting the project started. And as we get closer to June next year, I suspect there'll be some different discussions and people's positions may well have changed.
And just to add, the World Bank SAVE project, which is $100 million, is funding lots of projects like this in other higher education institutions, and we're not the only ones who are not looking to finish in time, potentially by June 2026. So I think that gives us a little bit of confidence that some arrangement will be possible to allow completion.
If there are no more burning questions, I think I'll draw the Q&A to a close. And those of us fortunate enough to be in the room and within striking distance of the Malawi gin and tonics, can carry on these discussions. I'm sure those online will have their own means of entertaining them. We all, of course, wish the project every success, both in its construction phase and then in the development of a dental workforce in Malawi that is quite clearly, from what Peter was saying, that desperately needed. But can I ask those present to, in the usual way, show your perceived? And with that, I was just going out by saying that the next meeting of the CPG is on Wednesday, the 7th of October, again starting at 6 p.m, where we will hear from 500 Miles Olivia Giles, who is joining us here this evening for a sneak preview about development and delivery of aesthetic and athletic services in Malawi. So anybody that wants a bit of a spoiler alert, let's speak to Olivia over the gin and tonics. Please note the meeting will also serve as our AGM, so I will be working with my colleagues to ensure where Forrest and everybody that needs to be here, but you're more than welcome to join us there. And with that, I'll close this meeting and to the drinks. Thank you very much.